last week on episode 3 of our Choosing You series.
My biggest, I was a 44D, and I went to a 34 triple D. Mother was living. It was nice to not have like that lower fupa, as Hispanic culture calls it, or West Indians might say gurney sack. I did not have that anymore. Stomach was flat. Okay, when I got pregnant, I gained 62 pounds. Up to February 2018, I was maintaining that, like I was like between 175 and 180 pounds. It's time for a postpartum glow up. It's time, because even the fanciest cars need a tune-up. Hi guys, welcome back to our channel, your favorite place for hauls, home decor, and all things homemaking. If you're joining us for the first time, welcome, and for those of you returning, we appreciate your support. This is part 4 of our Choosing You series. Part 1 was, of course, making the decision, and in that video I shared with you my struggles with weight for my entire life and how I came to the decision to finally have bariatric surgery. And part 2 was my bariatric surgery experience. Part 3 was my plastic surgery experience, because after losing about maybe 120 pounds, I wanted to be able to get rid of some loose skin. So I did have plastic surgery. Now part 4 is this video. In this video, I'm gonna talk to you about my postpartum glow up. So after having my first plastic surgery, I had my little one Peyton. She's 6 years old now, and at the time when she was about 4 years old, I had lost, I'd say, 40 of the 65 pounds that I gained from being pregnant. And at this point, I was ready to get a little glow up. So this video is going to share with you once again how I came to the decision, the pre-op experience, the experience of actually having the surgery, and post-op experience. So if you're interested in hearing about that, stay tuned. Making the decision to have plastic surgery a second time, and technically a third time, because if you watched our last video, you'll know that I had plastic surgery in America, on Long Island, in a town called Huntington, by Dr. Romanelli. Amazing experience, but if you guys watched my last video, you'll know that I had some complications and I had to go back under the knife again to get my implants, my breast augmentation redone. So now here we are. My daughter's 4 years old. I am consistently in the gym, but one thing that I haven't talked about is elasticity of skin. So you may see, like if you watch shows like The Biggest Loser, or any of those other weight loss shows where people are losing an inordinate amount of weight, you will notice that some people don't get loose skin. I don't understand. God bless them. I do believe it's genes. I don't agree, and this is just my humble opinion. I am not in any way in the medical field. I just have had a lot of experiences with weight loss for me, not experiences with weight loss for others. But I can say for me, my skin just does not have great elasticity. I'm grateful that it does have great elasticity when it comes to my face, because if you look at a lot of post-bariatric patients, you'll notice that some of them have like saggy skin under their neck. Their eyes may look a bit gaunt. They may have just, their skin looks a little less plump. It looks like it's almost been a bit deflated. I am blessed that I did not have that in my face, but that's the only area that I don't have that. If I gain and lose weight from the neck down, and I would say my upper thighs, I'm talking my mid area, I'm talking my arms, and when I say mid area, I'm talking front and back, my elasticity is just poor. I was able to snap back as far as my tummy tuck for the most part, but I wanted my skin to be a little bit tighter. I wanted to get a little bit more definition in my hips and in my butt. I wanted it to be a bit more defined, and I felt that there was just not enough working out that could get me to that point. Now, again, for those of you that might be certified in fitness or in the medical field, you may feel or you may find that this is not true. That's fine. But for me, one thing I want you guys to walk away with is it doesn't matter what anyone else thinks. Do your research. Be confident in the choice you make. And when I say the choice you make, I mean whether or not you're having it in America or you're having it outside of America. Be confident in the surgeon that you choose. And be confident in knowing what it looks like post-op. My biggest suggestion to you is really understanding what your post-op experience is going to be. And the only way you're going to do that is to make sure you have a really good conversation with your doctor and to make sure you do your own research. Do not rely on other people to tell you what they've experienced, because person A's experience and person B's experience will be completely different from my experience. And even all the information that I'm sharing with you here today, and I do plan to do another video. If this video does really well and you guys are interested, comment below. I'm happy to do a more detailed experience because this surgery was done outside of the country. And I will tell you that there are very few people that you'll come across that have had surgery in the United States and surgery outside of the United States. Typically people will only do it in America, or typically people will only do it outside of the United States. And one of the reasons that I made the decision to have surgery outside of the United States, so my round 3 of plastic surgery was done in the Dominican Republic. The reason why I made that decision is I did not lead with cost. And I think that's something that you need to be very, very comfortable with, is what the costs are going to be. And if you can afford it, do it. If you can't afford it, then you shouldn't do it. Please don't try to cut costs and say, well, I'm gonna go to this particular surgeon because they cost less money. Is the quality of work equivalent or exceeding the person that costs more money? Do they have a good rating as far as with the Surgeon Association, depending on the country that you're doing it in? How does their ratings look on several sites? Take a look at the reviews and be very, very detailed in looking through the reviews, because you will know, and I'm sure many of you are thinking,
oh, Dominican Republic, why would she get her body done in Dominican Republic? There's so many people that's dying out there.
Be clear. If you do your research, there are a lot of people that die in America as well. And when you look at some of the surgeons, you have to look at the amount of patients they have versus the amount of deaths. And you will find surgeons in the Dominican Republic are doing several patients a day. And a lot of those patients that do pass away, I mean, as terrible as it is, I'm not discounting that. You have to also look at the details, because what happens is a lot of people go outside of the country not because it's cheaper, because they're hoping that they won't find out, and they being the surgeon of choice, they're hoping that that surgeon won't find out some of their medical conditions that got them rejected by an American surgeon. So for example, many people have died under the knife outside of America because they have sickle cell. They did not inform the surgeon. They are told to stop smoking 3 months prior. I saw one girl in my recovery home that was smoking the morning of. You're putting yourself at risk when you make those type of decisions to withhold medical history from your doctor and go against what the doctor is telling you to do or not to do. So when I made the decision to go to the Dominican Republic, one of the reasons that I made the decision is not because of cost, as I said, but because of the results. They are much more aggressive with their procedures in Dominican Republic compared to what I have seen in America. And I'm talking about looking at several before and after pictures, okay? A lot of the surgeons in America are a lot more conservative when it comes to how much they're bringing in the waist, how much fat they're putting in your lower, in wherever you choose to do it, whether it's your you know, if you're doing like a BBL. But whatever the choice is, the level of aggression when it comes to how they approach the surgery in Dominican Republic, it's far greater than it is in America. And then again, that is my opinion, okay? So I made the decision to go to the Dominican Republic. I was going to have 360 lipo, and I'll explain what that means compared to America and how they price it. And again, when I was priced in America, this was almost 10 years ago. I don't know how much has changed since then. But in the Dominican Republic, they do 360 lipo, and that means you're doing front and back and sides. Okay, so you're doing your planks, you're doing the front, you're doing the back, upper and lower abdomen, upper and lower back. That's called 360 lipo. That's one charge. However, when I got it done in America, I had to pay for upper and lower ab lipo. I had to pay for upper and lower back lipo, and I had to pay for my planks. That is how they charge. So it was itemized out. Whereas in the Dominican Republic, it's one flat rate, okay? So I had, again, in the Dominican Republic, I had 360 lipo. I had inner thigh lipo, inner upper thigh lipo. I had an arm lift, which means they're doing like an incision and taking out excess skin. And then I had a BBL as well, which is a Brazilian butt lift, okay? That is typically when they take visceral fat, which is the fat from your abdomen, and they move it to your butt. Okay, so with that being said, quite a few procedures to be done. I made the decision to go with Dr. Yili de los Santos. That is who I chose, and I keep saying that because I know some of the comments that I've seen on other videos are people like, well, why did you choose this person? That's who I chose. That does not mean that that's who you should choose. I think that you have to find someone that is comfortable and you feel comfortable with. I would say about 8 to 10 months before I made my final decision. My final decision was through joining different Facebook groups, joining private Facebook groups that talk about Dominican Republic surgeries, looking at the before and after pictures, having a conversation in the overall experience, because I did initially choose another surgeon. I will not name her, but her responsiveness from her assistants was absurd. I know that these surgeons are very popular. I'm aware. However, I feel that I'm paying a cost and I have a certain level of expectations as far as responsiveness. Once I made a choice on my surgeon, the next step is that you need to find yourself a recovery home, because remember, if you're having a procedure out there, you're going to, depending on the type of procedure you have, they will tell you how long they want you to stay in the Dominican Republic before you come back to America. Don't try to cut costs. If you feel you only want to spend 4 days because that's all you have money for, and they're telling you 12 days, you can't afford to have the surgery, boo-boo. Don't do it. Don't do it. This is another reason why there have been fatalities when they return back to America. You return back too soon. If they tell you 10 days, just do the 10 days. If you can't get off from work, then that's not the time to do it. Make sure that all the stars align, all your ducks are in a row, and you're following the procedures and the the suggestions from your surgeon. So I chose a recovery home. I did end up staying, I believe I stayed for 10 days. The recovery home will charge you per night. Now, when they charge you per night, it's all expenses included. So that's your cost for a driver to go back and forth to the hospital. That's a cost for food. That's the cost for them to take care of you 100%. They bathe you after, they feed you, they wash your undergarments, they take care of all of that for you. Okay, now again, when it comes to the details as far as the vitamin regimen, all that stuff, if you guys want me to do a separate video on that, comment below. I'm happy to give all the details, but I'm trying to keep it kind of high level here. So I chose a recovery home. I made sure that I got myself down as far as my weight to where I wanted to be, but I did not want to lose any more weight in my stomach area, because again, that visceral fat, and if you take a look, a lot of the before and after pictures, you'll notice that the people that get the best results have the biggest stomachs. The bigger the stomach, the better your results when it comes to a BBL, because they're able to pull some of that visceral fat, which is the fat that really has the least chance of melting or disintegrating once you're, post-op. You don't want to get fat from an area that once they put it to your BBL 3-4 months later, it's gone. You don't want to burn that fat. So the best place is visceral fat. So they do typically get the best results when they have when the patient has a larger stomach. I did not have a larger stomach, so because as you know, I had a tummy tuck prior, so that was already a bit of a challenge for me. Now let's talk costs. In America, I had upper and lower ab lipo, I had upper and lower back lipo, I had a full hip to hip tummy tuck, I also had a breast lift and breast augmentation. That cost me a little under $20,000. When I decided to have my procedure in the Dominican Republic, I did 360 lipo, inner thigh, arm lift, slight arm lipo, and a BBL. That cost me $6,000. Huge difference. When I tried to price just an arm lift in America, the arm lift alone was $7,200. But again, my leading reason for going to Dominican Republic is because of the aggressive results. Their results are far more aggressive than America. Okay, other costs that you need to consider when you're going to have surgery outside of the country is you need to think about what the costs are going to be for you to travel to and from. That is another cost. So although the cost for the surgery itself is only $6,000, think of it as a la carte, okay? There are several other costs. There are costs for this recovery home. There are going to be costs for your undergarments. There are going to be costs for the medication that they give you. There's going to be costs for you to get your medical clearance in the Dominican Republic. They do not accept medical clearance from America. If you choose to do that, that's just your own choice, but you still have to come down and get all of your medical clearance in the Dominican Republic. Also, you are going to be paying for post-op care. Post-op care, you're going to have lymphatic massages. In the Dominican Republic, for the time that you're there, you usually get it like once, sometimes twice a day, depending on the type of procedures you've had. And then when you come back to America, I had about 12 weeks of lymphatic massages 2 to 3 times a week, and then it kind of got less and less as I progressed. Now, the actual surgery. So when you get to Dominican Republic, you have the medical clearance usually the day before, depending on the time you get there, but you usually get it 24 hours prior to the surgery. On the day of surgery, they're still doing additional tests to make sure that you're all set to go. Once you have the surgery, you have to also pay for an overnight nurse. This is another difference between the American hospital experience and the Dominican Republic. Think about in the American hospital experience, for those of you that have kids, I've seen many reels on Instagram done on this because it is the absolute truth. They don't give you a chance to sleep. The nurses are in every 15 to 20 minutes introducing themselves. Hi, just checking up on you, just checking up on you. Like, don't get a full night's sleep because they literally come in at least 2 to 3 times an hour. Not the case in the hospitals in the Dominican Republic. You have to pay for an overnight nurse. No one will come to check on you. That's not how it works there. You have to get your own nurse. So you get your nurse, you spend the night, the next morning they do your checkup, they discharge you, and then you go back to the recovery home, and that's where you're really getting a lot of your care. Now, here is one of the downsides to having, and actually, let me rephrase that. I wouldn't consider it a downside. It's just something that you have to be aware of. So during your medical clearance, they do, of course, do your blood work, and they will tell you that because of the surgery, depending on how low your hemoglobin goes during surgery, they may have to do a blood transfusion because you may lose too much blood. Now for me, I did have to have a blood transfusion because and I'll put a picture here, I looked, to be quite frank, like a corpse.
So Nicole is at a surgery. The doctor's saying that she's going to need a blood transfusion. You know, she usually has a very natural pink lip, and her lips are super, super white, almost my skin tone. She's gonna need a blood transfusion. Doctor says it's gonna help her heal faster. And they removed a lot of fat with the lipo. And with that, she lost blood.
I had no color in my lips. It was just a very scary experience. I'm so grateful to God that my best friend Xiomara was there, because I was out of it. It was not a good experience for me when I first came out from under the anesthesia. I did have an overnight nurse there, but I'm grateful that my best friend is Dominican and she also knows Spanish. So, because you know, we have some Dominicans that don't know Spanish because, you know, they're Americanized. That's why I'm clarifying that. And so she was able to do a lot of these translations for me. Now, don't fret, because as long as you have an overnight nurse, you'll be fine, because even the doctor does not know English. However, she has a translator and they're on it. They are on it. They will explain to her exactly what you want. But for me, I just wanted and felt more comfortable having my best friend there, because I feel like she has my best interest in mind. There are no ulterior motives there. So post-op, you go back to your recovery home. They will have you go for post-op visits. You will come back to the hospital. Again, the back and forth, the driver is included with the recovery home. It's a lot of pain. I thought, so in the plastic surgery world, they would call me a veteran, right? Because I'm now going in for round 3 of plastic surgery and round 4 for going under. I was not prepared. I think I went in there like, oh, well, you know, yes, I'm going to be in pain. Obviously, I'm not thinking I'm not going to be in pain. You see, I am a brown-skinned girl. The majority of my body was purple for at least 6 weeks. They tell you that you'll be recovered within a month. You can go back to work. Now, at the time when I went for this surgery, I was not working. I had chosen to leave my last job. I was set for about a year of not really having to work if I did not want to. But thank God, because I couldn't even drive until about maybe almost 3 months post-op, because I had a huge incision. My incision went from here to here on both arms, so I could not drive. I was out of commission for at least, I would say I did not start to feel like maybe 60% like myself till maybe 2 months after. This was a very intrusive surgery because I did a lot at one time, just like the first round. It's like I do this to myself every time because I feel like, oh, let me just get as much as I can get done, and it was a lot. It was a lot. So I do want to prepare you for that, you know, a lot of these doctors will tell you, oh, you'll be fine in 3 weeks. You'll be able to be back to work. Be prepared that that may not happen. And I say that because I don't want you to end up putting your job in jeopardy because of thinking, oh, it's only, I'm telling my boss I'm only gonna be out for 3 weeks and they're gonna need me after 3 weeks. What if you need 6? You just have to be prepared for that, and financially prepared as well. I was out of commission, I would say, for a good 3 months. After I came back to America, I was getting lymphatic massages 3 times a week, every single week. And then about maybe after 3-4 weeks of being back in America, it went down to twice a week. And then after about a month, it went down to once a week, and I kept going once a week for about 2 months after. The lymphatic massages are intense. I also got CO2 shots, which are supposed to help with the swelling. It literally feels like they are injecting acid into your skin. I will not exaggerate. For those of you that have had CO2 shots, you will be able to confirm that. It is extremely painful. I will put a picture here if I can find it of, I was crying every single massage. And I remember taking this picture because I said to myself, I'm gonna take a picture of how much pain I am in right now, so that if I ever think of doing surgery again, I will look at this picture and I will decide against it. It was intense. I love the results. I'm grateful for the results. I feel, and again, I don't care what anyone else thinks about my body. How I feel, I am really happy with the results. I think she did a phenomenal job. It's just that experience of recovery was tough for me. And it's funny because I have a couple people that I befriended while I was in the Dominican Republic, some that had surgery with Dr. De Los Santos, some that had surgery with others in the Dominican Republic, and they seem to not have had as much pain. Now again, they didn't do as much, so maybe that's why, but maybe it's the cocktail of procedures I chose to have at the same time, but it was very intense. And so I would say the tips I have for you is, number one, do your research. Do your research and do not rely on someone else that has done their research and say, oh, well, they went with that surgeon, I'm gonna go with that surgeon, because again, body types are different. You guys may be looking for different types of results, okay? Number two, if you choose to do surgery outside of the country, make sure that you have budgeted for double the amount of money that they charge you. And the reason why I say that is because the costs for things get pricey. For example, the lymphatic massages in the Dominican Republic, I think I paid $200 for 10 massages. In America, I paid $100 per massage. That's a huge difference. And as I said to you, I was getting them 3 times a week for like the first month, and then twice a week for like the second month, and then once a week for about 4 to 6 weeks after that. So it is expensive. So don't think, oh, they're charging me $3,000 for my procedures, so that's all I have to pay. No. Think about everything. Your garments are expensive, and you have to get multiple garments as you go down in your swelling, your compression garments, also known as faja, okay? You gotta be prepared for that. You can't skim on those items, because then that's going to impact your results, okay? The other tip that I have for you is make sure that you pay attention to the responsiveness of the surgeon of choice. Because if they are barely responding to you before they even get your money, how do you think the experience is going to be post payment? Okay? The last thing I would say is that you want to make sure that post-op, you're really paying attention to what goes in your mouth. Because it's not, this again, to me, my opinion is it's a tool. It is not the total fix. You cannot go and get your body done and then think, now I'm done. I could eat anything I want. Funny story, post-op, the day after they came to pick me up, the driver came to pick me up, and then like 2 or 3 other girls that had also had surgery at the same hospital, and they were going back to the same recovery house. Now he picked them up first because I had taken a little bit longer to get discharged, and he was going to come back for me. And he was explaining to us when he picked me up that these girls, as soon as they left the hospital, was like, oh, we want Kentucky Fried Chicken.
Sis, really? Really?
You just paid all this money, and these are the people that will pay all this money to get the surgery done. They look phenomenal. And then a year later, they gotta go back. And then they gotta keep going back and keep going back. So you have to make sure that you're in the mental mindset before you have any type of weight loss surgery and any type of plastic surgery, because this is a lifelong journey. And if you really want to do your best to keep it, I mean, and I mess up sometimes. I'm not saying I only eat carrots and tuna out of the can every day of my life. Absolutely not. I refuse to do that. But I'm in the gym on my low points 3 times a week, and on my greatest points 5 or 6 times a week, because I've dedicated my entire life to this journey. So that's my last tip. Just be prepared that post-op, after all that pain, be prepared. I swear, every single time my phone drops in my videos, oh gosh, Anyways, be prepared to handle your business in the gym and what goes in your mouth, because you want to make sure that you can maximize on the results long term. I appreciate you guys for staying with us until the end. We have one more video in this series that's going to be happening next week, and I'm going to be sharing would I ever have surgery again, and if there are any regrets that I have, and I'm definitely going to be open about that. Again, I thank you guys so much for staying with us till the end. Don't forget to head on over to Instagram and Facebook. Like, comment, subscribe on this video. Please share. Let's get this word out. We're really trying to grow our audience, and we're growing so nicely. I appreciate your support. We will be having an after the show that will be live. So next week's our last one. The following week after that, we will be going live on YouTube. I will not be doing a video pre-recorded. It will be live, and it will be a live Q&A. Any questions you have, I am open to answering them, because I'm here to support you on your journey. Again, thank you guys so much for watching. Until next time.